Well, hello everyone. My name is Suzanne Clark. I am the President and CEO of the U.S. Chamber of Commerce. I am joined today by Anita Allemand, who is the Chief Transformation and Integration Officer at Walgreens Boots Alliance. Anita, thank you so much for being here to talk about your role and your company and how you're reimagining healthcare.
Thanks for having me. Good afternoon.
We're thrilled that you're here. I think what you're doing is so interesting. So, new CEO, Roz Brewer, she becomes the new CEO in March of 21, and she, within 6 months, creates this new role, puts you in it, and we're talking about a retail leader, a pharmacy leader, who has great executive leadership, has a new strategic vision, is going through a major transformation, but you're doing this all while we're still in the middle of a global pandemic. So there certainly is a lot to discuss. Maybe we start with the title. So what is a Chief Transformation and Integration Officer?
Yeah, no, and thanks for the question. As you mentioned, when Roz Brewer came into role last October was a very pivotal point for us at Walgreens Boots Alliance. We introduced our 4 new strategic priorities. One was transform and aligning our core business. Second, and more importantly, where I'm spending most of my time around transformation and integration, is our new growth engine of Walgreens Health, which is really our expansion beyond pharmacy into other healthcare service. So really in my role, and you can imagine these key priorities of transforming our core business, building a new growth engine, all the while building a high performance team, and then allocating our capital in a very efficient way. There's a lot to coordinate across the organization. And my role really is to work closely with Roz and the divisional leaders to do 2 things. One, establish and coordinate our overall transformation agenda as we prioritize healthcare. And second is to operationalize and integrate the investments and the partnerships we have. I'll share with you some of the examples that we're working on with Village Medical, CareCentrix, and Shield. So these are all that we are investing in. And the goal really is to be able to integrate them very effectively to the organization. So doing 2 things. One is continue to look at where we need to invest in healthcare. And then second is making sure we're coordinating across the organization and across our partners to really derive value.
Okay, so you're reinventing Walgreens. This seems easy. But it must not take much of your time at all. But tell us, I want to ask you 2 questions. One, because it actually seems quite hard, what is the big picture goal? If you could explain to our audience in a couple of sentences what you're really trying to achieve.
Yeah, in the most simplistic sense, the big picture is to leverage both our healthcare providers, our pharmacists, our clinicians, so both healthcare providers and investments in technology to become the neighborhood healthcare destination. And that's really important because we think healthcare is very local. Each neighborhood is different, right? So to be able to ensure that we become that neighborhood destination. And the result of it is very simple. We'll improve access to care, we'll improve quality and experience, and ultimately drive down costs in the overall healthcare ecosystem. So again, it's to be the neighborhood healthcare destination. You know us as the neighborhood pharmacy and retail destination. We just want to be able to expand that and create additional healthcare services using both the clinicians and the technology.
So you administered some close to 70 million vaccines, 27 million tests. What did treating your customers in the pandemic and in kind of this new way, what did that mean? How did it contribute to the way you were thinking about yourself as a company and who you might be in a neighborhood?
Yeah, that the pandemic really, I would say, brought to light and made us all recognize and realize how important retail pharmacies are in fulfilling that last mile of healthcare. We are fortunate that we have over 30,000 trusted pharmacists who've built strong engagement and trust in the communities we serve. As you mentioned, the numbers around vaccination, testing, we realize that really as I mentioned earlier, care is so local, and especially during the pandemic, you know, almost half of the Walgreens stores are located in socially vulnerable areas, and that means 78% of the population lives within 5 miles of a Walgreens. So we had the ability and the responsibility, frankly, to stand up and address some of the persistent disparities in care and make sure that we were available and bringing our services into the community. What it helped us realize is the value that pharmacies provided in making care so accessible, ensuring medications, scaling testing, scaling vaccinations. So, as a company, we also, during this time, we accelerated every aspect of our digital agenda that was already taking place. We looked at how could we advance some of the most important investments we're making, both with the goal of ensuring we can deliver more healthcare services within these settings where the community needs us the most, and at the same time, making sure that our pharmacists and our technicians actually had the time to deliver these services. So we were leveraging technology and advancing our technology agenda so we could, in fact, ensure that they had the time by automating certain aspects of the job to be able to spend time in the communities, making sure that we were taking care of the neighborhoods. So as you said, the 67 million plus vaccination to date, we also relied, quite frankly, on a lot of local partnerships to go that extra mile. So in the beginning of the pandemic, our equity work was supported by key partner organizations who helped us expand our reach into the communities. So some examples, we partnered with Uber to secure free rides to and from vaccination sites with up to 10 million free or discounted rides to reach our patients wherever they are, especially those who lived in historically disadvantaged communities. We brought our COVID-19 vaccinations to community members through offsite clinics. And then we hosted several events to help spread the message in various diverse and community-based partners. So I think through the pandemic, two things. We realized the trusted role that pharmacists, pharmacy technicians, and pharmacies played. We realized that our pharmacists could and should be doing more to practice at the top of their license. And third is we ensure that all the digital investments, enhancements we were making would actually allow them to both go into the community and have time to deliver these services. So I would say it fundamentally shifted and accelerated a lot of the strategies and the investments we already had in place.
So what does that tell you moving forward as part of your strategic plan? Like, what are the other critical components, either in terms of people? We hear a lot at the U.S. Chamber about a worker shortage. So is that a critical component? What other kinds of critical infrastructure and people needs do you have?
Yeah, so absolutely. So as we think about infrastructure, I would say it's threefold. We continue to think about technology as a foundation of supporting and streamlining the pharmacy care model. So I'll give you an example. Walgreens is one of the first pharmacies to leverage micro fulfillment centers to drive efficiencies and cost savings in that last mile delivery of prescriptions. So by removing some of the work from pharmacies, pharmacists get additional time to focus on providing patient care and clinical services. So it helps us in that labor shortages. So these centers remove routine tasks and excess inventory from the pharmacies. We also use cutting edge automation technology in our existing distribution network to fill almost 50,000 prescriptions daily. So the prescriptions are filled offsite, but they come back into the stores for patients to pick those up. So we've opened 2 microfulfillment centers, and we plan to open an additional 9. So think about technology as a core, as I mentioned again, of automating and removing work. The other, I would say, infrastructure that we are focused on through pharmacy is expanding our services. We can fill gaps in care in communities where physicians are not easily accessible, and we can help to ensure that everyone has access to essential medications and health services. In fact, 9 in 10 Americans, as I mentioned, live within 5 miles of a pharmacy, and pharmacists are oftentimes, they see patients see their pharmacists and their pharmacies more than they do their actual physicians. So we're investing in additional services we've proven the value of the pharmacist. So we're expanding the role of the pharmacist to in certain states where we can test and treat patients. So examples of that could be flu, strep throat, RSV, etc. So I know as a busy mother of kids, the ability for me to be able to take my children, have them quickly tested for strep, and then have the pharmacist in fact be able to prescribe and treat those symptoms with a antibiotic or an antiviral if needed. I think again, that's another example of reducing time to treatment and reducing some of the administrative burden we have in the healthcare system too. So I would say continued emphasis on technology, continued emphasis on additional services that pharmacists can do, all that wrapped around ensuring that we have a digital infrastructure so our customers and patients can really leverage us in an omni-channel way, digital technology to fill their prescriptions, get their questions answered, find care, treat care. So really it's around meeting patients and consumers where they are.
It's interesting. I was lucky enough to spend some time with Roz a few weeks ago, and this concept of how many street corners, how many counties you're in the United States is a big piece of this, isn't it? And you have the footprint to expand access.
Absolutely. Absolutely. And really importantly, where we are, especially, another example I'll give you, our partnership, as we think about what else are we doing in healthcare. And I'll walk through some of the partnerships, but that footprint and customer base is really important for us to scale new healthcare models. So I'll talk about Village MD. Through our relationship with Village MD, Walgreens is the first national pharmacy chain to offer full service primary care practice sites alongside pharmacy services. So this is not just about, transactional acute illnesses. This is Village Medical at Walgreens provides full service primary care, medications, immunizations, lab testing. Imagine, if you will, 4 to 5 exam rooms, lab, all of that, just like you would if you go into a primary care physician's office in a very simple one-stop care model. And half of these clinics are located in medically underserved and rural areas. So think about really expanding access, especially in medically underserved and rural areas. So the footprint really becomes very helpful as we think about scaling additional healthcare models like the primary care model. The second example I'll give you is what we're calling health corners. We have 60 plus Walgreens health corners with the goal of 100 plus by the end of this year, where we're working with 3 payer partners. These are health plans: Buckeye Health Plan in Ohio, Clover in New Jersey, and Blue Shield of California, to deploy health services to their members. And they become really, these health corners become an extension of the health plans that are located in select Walgreens stores with a dedicated space where a registered nurse or a pharmacist can provide healthcare services. And they range anywhere from preventative care and wellness checks to managing chronic conditions. So think, as an example, of scheduling a mammogram, scheduling a patient for a high blood pressure or diabetes, helping them find digital medical devices. So really, again, going back to your question about managing that footprint for additional healthcare services, because oftentimes, as I mentioned, there is a big gap between when a patient goes in to see their physician to the next visit. So in some cases, if you're just going in for an annual screening, you see your physician once a year. All those other months between, our footprint and our services can help patients be really healthy by doing some of these routine preventative measures.
So I'm trying to envision across the breadth of your stores. How do they look different in 1 year? How do they look different in 5 years? So how will it feel different for me to go to my Walgreens in Arlington, Virginia? And how will it look different, feel different in the coming years?
Yeah, no, again, good question. So, as I said, one of the key tenets of what we are doing is building partnerships and building partnerships in local areas. So the 2 others that I did not yet mention, we have investment ownership in a company called CareCentrix. It's a post-acute, and home care is one of the most important aspects of that patient journey. So they're focused on creating a world really where individuals can, they come out of the hospital, they can either go into a skilled nursing facility or, in fact, heal and age at home to provide an expansion of our capabilities. And I say this because I'm going to use a very specific example of what our stores will look like. So hospital readmissions is at this point one of the costliest episodes to treat. The statistics show that almost 30% in some cases of patients are discharged from the hospital, and within 30 days they're back in the hospital. Lots of reasons for it, some of which, a big percentage don't have primary care physicians. Some of them go into the hospital with a set of medications while they're in the hospital. They're prescribed a different set and they come out with a different, and it's confusing for those of us who even live in this world of healthcare to understand, what am I taking? Should I take the ones I took before? So those are some examples. And so now imagine a world where we're actually able to connect all of this. So someone coming out of the hospital, through our partnership with CareCentrix, there's someone at the time of discharge, helping them understand, do you have a primary care physician? No, let me, if it makes sense for you, connect you to a primary care physician within Village MD, which is in a Walgreens store. As they are leaving the hospital, they might say, I don't want to go in a skilled facility, but I want to go home. We can take care of all their home care needs, whether it's durable medical equipment, whether it's medications. Our Walgreens pharmacists can help them manage their medications, help them do what's called a medication reconciliation. So now they know exactly what they need to be on, and then continue, if they want to, between their visits to their physicians, come in, get their blood glucose checked, get their blood pressure checked. So you can imagine a world where Walgreens now becomes our footprint, our stores start looking very different. It becomes really a healthcare destination where more and more healthcare services and care can be delivered. And, with the rising healthcare costs and more burden being placed on patients to cover these costs, patients are going to, and customers are going to demand more care be delivered on their terms, whether it's about having access, whether it's having a coordinated experience. And so you'll start to see our stores really all about, the retail space will increasingly become that destination. And it's about making, whether it's all the way, so think about wellness and prevention. So what products we're offering in our stores with wellness in mind. Then we've got our pharmacies. Now you've heard me talk about screenings, devices. You have a personal advisor helping you decide, I have diabetes. What digital device should I use? There's so many digital devices. How do I actually use it? How can that data be stored somewhere where my physician, my pharmacist have access to it? And then based on that data, can the pharmacist reach out and say, hey, I can tell that you're not taking this medication. What can I do to help you? Is it about financial literacy? Is it about understanding? And then really think about across that continuum. Now that same person is in the hospital. We can care for them in the hospital when they're discharged all the way through end of life. So our goal is end-to-end services that are unique and personalized to each individual customer or patient, and the ability to deliver it in local neighborhoods. Now, we also know, that works for my 81-year-old mother who goes into Walgreens every week and wants to talk to her pharmacist. It doesn't necessarily work for me as a busy professional and a mother of, two teenage girls. And so for me, it's all about digital technology. Tell me what I need to know, show me easy access, deliver these medications to my home, help me make the right choices. So we're really thinking about how do we personalize all of this, leveraging both technology and our footprint to be able to do it. So a year from now, you'll start seeing all these services that I said. So you'll see primary care physicians in pharmacies. You'll start to see us coordinate more care across the ecosystem. 3 to 5 years, our footprint in our retail space will look very, very different. You'll walk in and you'll say, I am in a healthcare model, a care delivery model.
It's a big vision. Let me ask you, in the minute we have remaining, Anita, what makes you optimistic about the future of healthcare in America?
I would say two things really. One is, if you look back and you think of the success we had in the pandemic, it was really a validation that this model works. We've got the trust, we've got the engagement, we have the footprint and access. So that gets me really excited, knowing that we were able to do that, and then now we're building upon it. The second thing that makes me really optimistic is across the spectrum. If you talk to anybody, patients, and we do a lot of testing, they're ready for a different experience. Healthcare is fragmented, it's expensive, it's confusing, and it's always been, it's been a different model. And WBA and Walgreens, we want to put the patients and the customers right in the middle, and say, what is it that you need? How can we make it personalized for you? How can we make sure that we understand all your needs? And then we can think about how we coordinate. So to me, that's really, it's healthcare is becoming like other industries where the patients are driving the decisions. And we know that we have the ability to help them do that. So those are the two things to me get me really excited about our strategy because I know we can do it.
Anita, thank you so much for being with us, for sharing a big vision, a big plan, and an optimistic look at the future. We appreciate your work and look forward to checking back in with you along the journey.
Absolutely. Thanks for having me.